Hi everyone, Dr. Amy from Pain Free and Fit and Walkaway Back Pain. Today, a great walking exercise for those of you with lower back retrolisthesis, learning how to use your latissimus or lat muscle with arm extension. Hope you enjoy. So if you've seen any of our other videos on low back retrolisthesis, one of the things that we've talked about for those retrolisthesis cases that do not have a neurological compromise to them, meaning that you don't have sciatic or stenotic pain that runs down your leg due to an increased arch of your back, typically most cases of retrolisthesis are alleviated by increasing the arch in the lower back. And that's because with retro, many times what happens is the pelvic inclination, meaning the tilt of the pelvis or the sacrum, is such that there is a decrease or a flattening of the lower back curve. What that does is as that lower back curve flattens, it causes the vertebra to shift slightly backwards. And if you have retrolisthesis and your ligamentous tissues in that area have become unstable, that vertebra sliding backwards is aggravated with flexion or bending forward. The more we bend forward, the more we aggravate retrolisthesis pain. 30 years of dealing with patients with retrolisthesis, it's very important to do a body analysis on my patients or my online clients. When we do this, we find out what exact position of the spine, whether you need anterior pelvic tilting, posterior pelvic tilting, a hip correction, a low back muscle correction, a torso correction, to decrease the mechanical stress on your retrolisthesis soft tissues, which is causing pain. Today we're going to be talking about using the lat muscle, which is one of those mechanical issues that many people with retrolisthesis have, which runs from our shoulder all the way down to our lower back. When the lat contracts, it increases the arch of the back. It also helps to bring the thorax backwards and lift the pelvis backwards, because as the lat contracts and we increase that arch in the lower back, it helps to reduce the pressure on that retrolisthesis vertebra. As the low back arches, retrolisthesis has a tendency to mechanically be forced forward, back into a more normal position. Again, realize that with most people with retrolisthesis pain, we're not talking about a big shifting of the vertebrae here. What we're talking about is the direction of stress and motion in the body. And when we increase that arch, it's going to alleviate many times retrolisthesis pain because it forces forward that vertebra, the disc. It helps alleviate internal disc pressure. It helps to alleviate joint capsule tension that's in the vertebra from having that forward slump posture. So to do this, while we walk, all we're going to emphasize is the amount of swing that our arm goes backwards. Because the lat, when it contracts, it pulls the arm backwards. As you swing and as one foot comes backwards, let's say my left leg is coming back, my right arm is going to come back at the same time. So emphasizing the amount of swing of your arms backwards, not necessarily forwards, but backwards. You could increase the overall range of motion. But swinging your upper arm, don't worry so much about your forearm, but your elbow and your upper arm backwards with each step is going to contract the lat greater. It's going to put more of an extension force into the upper body, which is going to accentuate that curve. Simple tips like this can go a long way to self-rehabbing or self-managing your retrolisthesis pain. Remember, you don't need a lot of exercises many times. You just need a few key ones that address your mechanical issues. With that being said, remember, if you want more exercises to figure out your mechanical issues and figure out a good design program to help self-rehab your lower back retrolisthesis pain, check out our fast track program for retrolisthesis pain available at painfreeandfit.com. And it has all of your analysis in it that you need to figure out your body mechanics, as well as the corrective exercises, and helps you design a rehab program that you can do, an actual exercise program to help change your mechanics, get your low back in shape, and start getting back into fitness and doing things with your retrolisthesis that you were not able to do before. We also have a walking program for those of you who are not interested in a full tilt exercise rehab program that you can self-design, such as the fast track program for retro. But we have a walkaway back pain program, which is chock full of walking exercises for lower back pain, not only retro but all different types, designed again around your mechanics, and it also has the analysis as well as an instructive course of action you can take to increase your back fitness, change your mechanics, and decrease the stress that's causing lower back pain. I hope you enjoyed this video on latissimus dorsi contraction and increased arm swing going backwards, not only with range of motion, but with the force going back to really engage those lat muscles, increase the arch of your back, and decrease the pressure on that retrolisthesis pain and help it move and be stressed a little bit more forward away from that aggravating backwards translation posture.